A mom from Shreveport is making medical history. She's just the second person in Northwest Louisiana to get a new treatment that can delay the onset of type 1 diabetes. It's been an emotional journey filled with ups and downs, but there's new hope thanks to this breakthrough. KTBS 3's first news anchor Shannon Brenius has the story.
When Nina Mooney in her 30s had 3 kids, each brought with them the special joys of parenthood and unique challenges. She developed gestational diabetes with each pregnancy, as shown by her blood sugar.
It had been in the pre-diabetes range for a few years, and it finally knocked me into the diabetes range. And my nurse practitioner said, well, let's just do the type 1 antibody testing just to rule it out. She was like, but I'm not expecting it to come back positive. Everything points to type 2.
Type 1 diabetes is an autoimmune disorder where the body's immune system attacks and destroys insulin-producing cells in the pancreas, whereas type 2 diabetes is when the body becomes resistant to insulin or doesn't produce enough of it.
You may think, I'm too old, that's juvenile diabetes, but that's not true. The average age of diagnosis for type 1 diabetes is now about age 22. That's, of course, past the age of seeing a pediatrician.
But Mooney had an advantage because PA Heather Roan and her colleagues were launching treatments of an FDA-approved drug called teplizumab.
Type 1 diabetes it's basically autoimmune destruction where your body actually attacks the cells that make insulin in the beta cells that make insulin in your body. So this drug actually goes in, it's a monoclonal antibody that goes in and it blocks those cells that attack, the immune cells that attack the cells in the pancreas. So this medicine just goes in and attacks those cells and allows the beta cells to live and to continue to make insulin. And so this medicine delays that process.
It involved 14 consecutive days of appointments consisting of 30-minute infusions of the drug.
So it's still a fairly new drug. A lot of people haven't done it because it's hard to catch it while it's still in stage 2. A lot of people don't find out they have type 1 diabetes till they end up in the hospital with their blood sugar really high. So I feel very fortunate that we were able to catch it early to put me in this position where I could do this medicine.
Because not only are we delaying the onset of type 1 diabetes, but I'm in hopes if we can delay it, if some of these newer drugs that they're also working on right now, maybe we can even prevent it even farther down the road. So anything we can continue to kick the can down the road in a sense to help prevent that. And then who knows what other drugs that are on the horizon that can help.
Again, you have to catch type 1 diabetes before your symptoms start and for it to be involved in this treatment. And to do that and to look for more information on how you may find out if you're eligible or what specific risk groups are supposed to be getting tested, we've got a link to some good resources on our digital platform, KTBS Plus.